Automatic cognition works by matching a situation to a known pattern, then applying the rule that goes with that pattern. These rules are called heuristics. They're not rules of the explicit kind, such as look both ways before crossing the road, but take the form of deep tacit knowledge which is not easily formulated, shared or transmitted to others. They're learned from repeated personal experience. They cannot be learned from books or teachers who can only instruct on how to practice. Heuristics are used where analytic thinking would be too slow or demanding. Internet search engines are an example of the effective use of heuristics. Here, the sheer quantity of available information makes exhaustive searching impractical and undesirable. Effective heuristics will generally provide enough relevant items and do so quickly. We're generally not aware of using heuristics, only of their outcomes. Over 50 heuristics have been described. Here are a few, taking the top 3. The salient or availability heuristic is our tendency to think an interpretation of a situation is true simply because it readily comes to mind, such as from a recent case. The anchoring heuristic makes us persist with an initial belief despite new evidence against it. Confirmation bias makes us seek and interpret evidence to support an existing belief and disregard evidence against it. Heuristics are also called cognitive biases because they determine our preference for drawing one conclusion over another due to psychological factors rather than objective evidence. Despite the ominous sound of the word bias, this refers to a normal and in most cases valuable mental asset. Heuristic cognition is fast. There is no appreciable delay between pattern recognition and guide to further action. It also requires little mental effort. For these 2 reasons, it is the default mental process. Unlike analytic cognition, automatic heuristic cognition appears to operate in multiple parallel pathways. It is not clear whether these are really parallel or whether the speed of heuristic cognition allows effective multitasking through a single channel, but the effect is, for the practical purposes, quite similar. And heuristic thinking can go on whilst analytic thinking is engaged with something else. Analytic and heuristic thought are prone to different kinds of errors. The main error of heuristic cognition is matching the wrong pattern.
The young doctor's first day in accident and emergency was a bit of a shock. A male patient in the resuscitation bay with 4 recent admissions for severe asthma had arrived and was unable to speak. A quick chest examination revealed very little wheezing, which comforted the doctor somewhat. He then tried, with some difficulty, to get the rest of the patient's history and the examination done, just as he'd been taught at medical school. The patient's consciousness level suddenly deteriorated and his heart monitor showed a slow rate with bizarre ECG complexes. Cardiac arrest was imminent, so the doctor summoned help. After a few minutes of hectic activity, the patient was safely anaesthetised and ventilated, receiving treatment for severe asthma and a precipitating chest infection.
Heuristic thinking is prone to another group of errors. When the right pattern is matched, the rule can be misapplied. This leads to errors of omission when something should be done, but nothing is. Commission, when nothing should be done, but something is. Substitution, when something should be done, and something is done, but it's the wrong thing. Again, heuristics can't avoid these errors that requires analytic thought.
A caesarean section requires antibiotic cover with coamoxiclav, which is drawn up in a syringe in advance. Therefore, it's ready for intravenous administration to the mother just after the umbilical cord is cut. In this scenario, a woman had a caesarean section under spinal anaesthesia and was cuddling her new baby with her partner present. The anaesthetist had previously asked the operating department practitioner, or ODP, to draw up the drug, then checked it with her. Since this approach involves 2 checkers, it's arguably sounder than the alternative, in which the anaesthetist prescribes, selects from the cupboard, draws up, dispenses, checks, administers, and then records a drug, all without any other person involved. The anaesthetist checked with patient and staff for allergy to antibiotics, then gave the drug over 3 to 4 minutes. The patient rapidly became unconscious and required emergency intubation and ventilation, thus running various risks. However, she remained well oxygenated and was otherwise stable. Later it emerged that the drug given was the anaesthetic induction agent, thiopentone, which is also drawn up ahead, also in a 20ml syringe, and is also a pale straw-coloured liquid.
So errors of heuristic thinking are made more likely not by things that impede heuristics, not much does, but by things that impede analytic thought. Let's look at a few. This is especially true of negative emotions such as frustration and anger, which make it particularly difficult to switch into analytical mode. It also seems that switching to analytical thought has the effect of lessening the intensity of such emotions. This is an important part of conflict resolution, where a valuable strategy involves leading an agitated person towards analytical thinking. Tiredness is a short-term state aggravated by sustained concentration, sleep deprivation, and stressful situations. Switching to analytical thinking is more difficult when we are tired. The solution to tiredness is simply a good night's rest. Fatigue has a similar meaning to tiredness, but is often used to describe a longer-term state aggravated by long periods of high-intensity cognitive effort over weeks, cumulative sleep deprivation, and other life stresses. As with tiredness, fatigue reduces our ability to switch to analytic thinking. The solution is a holiday rather than a good night's sleep. Other problems requiring analytic attention, such as financial concerns, family matters, and so on, do not impair our ability to switch into analytic thinking mode, but do occupy the single and slow analytic channel. Multiple interruptions have a profound effect on analytical thinking because the processing speed is slow and therefore more prone to interruption. It's more complex, so after interruption, more backtracking has to be done to get back to the same point. The switch between automatic and analytic usually happens appropriately, but the risk of failing to switch or to consciously guide automatic processes rises with those factors. We can get stuck in analytic mode. This is called fixation. We don't get stuck in automatic mode, but we drift into it by default, a risk we all may recognise.